Yeah. Dr. Rutledge, again, a very common question coming from almost every patient. How do they eat after mini gastric bypass, and what is exactly the difference in eating after MGB as compared to other restrictive procedures like sleeve or Roux-en-Y or gastric pan?
Well, the general rule with MGB surgery, with any surgery, without surgery, is to eat a healthy diet. Now, many people get tricked by this. They think protein powders, high fat, junk food, keto diet, things like that, high vitamins and things like that. All the data, I think, is summarized in a lot of research, but the American Heart Association has a simple way of saying this. Almost at every meal, eat almost all plants, almost all the time. In other words, just start off with that. The second thing for MGB is small stomach. So what that means is, for best experience in my patients and talking to your patients, eat a small meal 6 times a day instead of trying to do it 3 times or 2 times. Now, there is reason to try compressed eating, but that's a long story for now. The shortest thing is, first, really simple. Most meals, eat something healthy. That means fresh fruits, vegetables, whole grains, foods like that. And eat that in small amounts 6 times a day for the MGB. Not just for MGB, for every kind of diet, for every kind of situation, for every kind of surgery. And many surgeons don't recommend this, and I talk to those patients around the world for the past 2 years, and they do worse when they violate those things. And when they choose to eat that way, they get the benefits. Like, let's mention a few benefits. Eating healthy plants, foods mainly, not only, mainly. You get less inflammation. You get less intake of salt and sugar, both of which cause high blood pressure and obesity and diabetes. You get improvements in the other mediators of good health. So MGB helps punish you if you eat a high-fat diet, a high-sugar diet, a high junk food diet. And so go with the MGB, fight MGB and healthy diet, almost an unbeatable.
How do you compare the eating volume between MGB, sleeve, and Roux-en-Y?
Well, I don't think I would say volume. Both the sleeve and the Roux-en-Y both have very narrow, small pouches. But many people teach them to eat like protein powders or drinks or things like that. What we say is, when you have that small pouch, you might sit down to a big meal of fruits and vegetables. You might say, oh, I can't do that. So then they say, oh, I'm hungry. I can't eat this big meal of fresh fruits and vegetables. So instead, they eat junk food, because pizza, chicken, greasy, junky foods. So what happens then is they eat high calorie, high fat, high sugar, high salt foods, and then they can destroy the sleeve, destroy the Roux-en-Y, and even the MGB. Again, we can punish them by doing a longer bypass, but a longer bypass has some risks. So the simple answer is no tricks, but remember what the basics have been from all the research findings, including most recent. Eat a healthy diet first.
That's it. Thank you.